Thank you to Daphne Hoke-Cunningham and Roland Hoke for supporting this great lecture series and for their support of Tufts. Some of the things that others have said, Coco and others said, I want to highlight again. We at the Friedman School, we're hoping to launch, probably not by this coming September, but hopefully by this coming September next year, I should say, not for this year, a 4+1 program so that undergraduates can, when they're freshman or sophomore year, apply to and get into a program where they'll earn their master's degree along with their undergraduate degree in 5 years. Also, someone mentioned businesses and thinking about the private sector. Tufts actually has, you may not know, the largest academic industry nonprofit collaborative around food and nutrition innovation in the world. We have over 100 companies and nonprofits across the food sector who come together and are part of our Food and Nutrition Innovation Institute at the Friedman School. Actually, we have 2 meetings a year, and I think it's next week, is our fall meeting, and then we have a spring meeting. And so students who are interested in both nonprofit and private sector innovation and entrepreneurship around food, linking with companies, linking with ideas, linking with funding, creating startups, or getting jobs at some of these companies, should look up our Food and Nutrition Innovation Institute and think about coming to our in-person event next week, which will also be, I think it's next week, which will also be live. So I'm going to talk about the White House conference, and probably most of you didn't know this happened, which is okay. There's a lot going on in the news, but this was really a historic event, a once-in-a-lifetime event, and I hope it will have some serious positive consequences. But let me go through this. So I'm a cardiologist, and one of the first questions people often ask me is, how did a physician get so interested in nutrition and become the dean of a graduate school of nutrition? And this chart and this data sort of tell the story. What this chart shows is the deaths in 1 year in the United States from different causes. There's hundreds of thousands of deaths along the bottom axis, and you can see that poor diet is the top cause of death in the United States. And so in this analysis, estimated to cause about 500,000 deaths per year directly due to poor diet, mostly from cardiovascular diseases, diabetes, also some cancers, other things. This is probably an underestimate because it doesn't include things like brain health, gut health, renal, kidney disease, peripheral vascular disease, many other things. It's actually probably an underestimate, but that means at least 1,000 deaths every day directly from poor nutrition in this country. It's literally this quiet tsunami of human suffering that we just all sort of walk around, not all, but most Americans walk around thinking it's okay and it's normal, and it's not normal, and it's new. And so this is why, as a physician, as anyone who cares about health or public health, you have to care about food at the top of your list. And we've become so sick from poor nutrition that you really just have to step back and just look at the statistics. It's so shocking. 1 in 2 adults in the United States has diabetes or prediabetes. 1 in 2 adults will get cancer in their lifetime. 3 in 4 have overweight or obesity. And if you put that together with high blood cholesterol and high blood pressure, only 1 in 15 adults, and that's from age 18 up, so most of those 1 in 15 are young adults, only 1 in 15 adults are actually healthy, if you just look at some basic metabolic parameters. So 14 out of 15 adults are walking around sick all the time, driven by poor food, and it's sort of become normalized, and we don't realize how sick we are and how sick we feel walking around. And this is not just in adults, even among teenagers. This is age 13 to 18. 1 in 4 have prediabetes, 1 in 4 have overweight or obesity, and 1 in 6 have non-alcoholic fatty liver disease. So it's just shocking how sick we are. And what I think is going to drive change is not the human suffering, not the inequities and disparities, but the economic costs. I think the economic costs are what's going to drive change, because this is absolutely suffocating our economy. 50 years ago, about 7% of the economy was spent on healthcare. It's now 18% of the economy. $1 in $5 America spends is on healthcare. 1 in 5. There's no other sector that's this big. And 50 years ago, healthcare spending was about $1 in $20 in the federal budget and $1 in $20 in the average state budget. It's now almost $1 in $3 in the federal budget. It is the largest single spending category of the federal budget, if you don't count Social Security, which has a revenue stream and an exit stream. In terms of pure spending, this is the single largest category in the federal budget, and it's squeezing out every other priority. And then we wonder why we don't spend more for education or infrastructure or other things. It's all being drowned out by healthcare spending. This is also true for US businesses. Even adjusted for inflation, US business spending on healthcare has gone from $80 billion 50 years ago to $1.2 trillion a year now. So it's just absolutely suffocating American companies. And per man, woman, and child in the US, we now spend $11,500 per year on healthcare. And it's just shocking. That's $46,000 for a family of four spent on healthcare. The median family income, what's the median family income in the United States? Does anyone know? It's $56,000. We're almost spending on healthcare, almost the median family income is being also spent on healthcare. And that's way more than families spend on food and more than they spend on food, housing, and transportation combined for most families. And 80% of all of our healthcare spending is on preventable chronic diseases, things like cardiovascular disease and diabetes and obesity and other related diseases. Much of that is due to food spending. And just diabetes is the canary in a coal mine for the metabolic health of a population, rapidly shifts up and down depending on nutrition and metabolic health. The US government, the Medicare, Medicaid, the VA, the Department of Defense, spends $160 billion on direct medical spending for diabetes alone. How much do we spend on the entire Centers for Disease Control and Prevention? All the CDC, what is it, its budget? Anybody know? It's gone up. I think it's gone up in COVID. It used to be about 10 billion. I think now it might be 12 billion, right? The Food and Drug Administration, also about 10 billion. The National Institutes of Health, about $48 billion. The entire Department of Education, I think, is about $90 billion. We spend more on just treatment of one disease. The government spends more than the CDC, FDA, and NIH combined, actually twice as much as the CDC, the NIH, and FDA. It's so much money that I don't think we realize how much we're spending on healthcare. And an analysis by the Rockefeller Foundation put this all together, along with lost human productivity from illness, and estimated just from human health, the food system is costing $1.1 trillion a year to our economy. And if you add loss of environment and biodiversity and other livelihoods, it's about another $1 trillion. And since we spend about $1 trillion per year on the food system, that means for every dollar we spend, we lose $1 in health, and we lose another $1 in the environment. And so we're losing $2 in our economy for every dollar we spend. This is not a winning economic formula. You don't have to be an economist and have a degree in economics to know this is not a winning formula, to have a segment of the economy that's costing the economy money. And so this is, I think, the main argument that's going to drive change is the economic argument. And COVID-19 has put an exclamation point on this, not only highlighting disparities by race and geography and ethnicity and income and education, not only highlighting challenges to food security and access, but also highlighting the challenges we have to poor nutrition and diet-related disease. The top risk factors for poor outcomes from COVID-19 beyond age are obesity, diabetes, and hypertension. Those were by far the biggest predictors of poor outcomes if people also had diabetes, obesity, and hypertension. And we did an analysis estimating that if we had a metabolically healthy population in the United States without the rates of obesity, diabetes, and hypertension that we have, we would have prevented almost 2/3 of all COVID hospitalizations and deaths. And so the US, as you probably know, has many, many more COVID deaths than proportional to its population in the world. A lot of that is driven by the fact that we're sick. And why COVID-19 interacts with obesity, diabetes, and hypertension is because COVID-19 is not just a respiratory virus. If it was just a respiratory virus like flu, it wouldn't be causing all these deaths. It wouldn't be causing all of these long COVID syndromes and all of these other conditions. It's not just a respiratory virus. It's a vascular virus infecting blood vessels throughout the body, and it's an inflammatory virus causing intense inflammation. Diabetes and obesity and hypertension are vascular inflammatory diseases. And so we've we figuratively pouring gasoline on a smoldering fire when we've put COVID-19 in a metabolically ill population. And so I think of COVID-19 as a fast pandemic on a slow pandemic. The slow pandemic is obesity and diabetes. The virus came in as this fast pandemic on top of a pandemic that we already had, and these two pandemics interacted. Now the public gets this. They kind of understand over the last 10 years that the food system is making them sick, but they're also really, really confused about what to do about it. And there's so much conflicting information and science and knowledge. And so we have to fix that confusion. But The public gets it, and that's a huge opportunity to move forward because the public is shifting their purchasing and their opinions because of their understanding that the food system is making them sick. And nutrition science has also rapidly advanced in the last 50 years to be able to deal with this. You know, we don't really realize how new nutrition science is as a field. The science of nutrition and chronic diseases is probably only about 30 years old, really only started 1980s, 1990s, and it's really only taken off after 2000. What this chart shows is the number of scientific publications that you can find on diet and cardiovascular disease, diet and diabetes, diet and obesity in every decade from the 1960s. And you can see the science is pretty much doubling. And so most of what we've learned built on the foundation of prior science has been learned after 2000, just in the last 20 years. And that science hasn't yet been translated into policy change and into to industry and to the public. And so that's what we need to do, is take this new science and translate it. And so I'll first just highlight some of what I think we've learned from the science and what I think we know, and how we have to now implement this into policy, and tell you about the White House conference. But so I think first what we've learned is that if we really want to have good health, we have to focus on foods, not individual nutrients. And this is a big change from 60 or 70 years ago, when all the science was about individual nutrients. All the science was about niacin and thiamine and vitamin A and nutrient deficiency diseases like pellagra and rickets and night blindness and scurvy, which was a major problem for sailors. All the science of the mid 20th century was about single vitamins and single nutrients and deficiency diseases. And so we are shifting now the science to understand that for chronic diseases, complex chronic diseases like obesity, diabetes, cancers, cardiovascular diseases, gut health, brain health, single nutrients aren't really that important. It's about complex combinations of foods. So that's, I think, the first message, is that it's about foods. The second message is that it's not eat everything in moderation. It's absolutely not true to eat everything in moderation. There's things that are good for you and there's things that are bad for you. And you want to eat more of the things that are good for you and less of the things that are bad for you. And so at the top of the list, are protective foods: fruits, nuts, fish, vegetables, plant oils, whole grains, beans, and yogurt. All of those foods very consistently have been shown to be linked to better health outcomes. In the middle, and these are the foods that I would say eat in moderation, would be minimally processed animal foods, foods like cheese, poultry, milk, eggs, butter, and unprocessed red meats. And cheese is maybe a little bit higher than the rest. Dr. Wolf was here, it sounds like, probably telling you about the microbiome of cheese. There's active microbiome in many cheeses. It's a fermented food. It's the top fermented food consumed in the United States. Fermentation creates new vitamins that don't exist otherwise, like vitamin K2 or menaquinones. So we don't really know for sure yet, but it seems that cheese may be a little bit good for diabetes risk, but again, mostly neutral. Chicken, turkey, milk, eggs, butter are pretty neutral. They're not good for you or they're not bad for you. People say, well, should I have butter? I say, well, compared to what? Butter is worse for you than olive oil, but butter is better for you than bread. So, if you want to butter, someone says, should I butter my bread? Say, have the butter, don't eat the bread, right? Because the bread's actually worse for you than the butter. It's a neutral food. And unprocessed red meats are probably a little bit bad for us, not because of the fat, but because of the heme. The heme iron at high levels damages the pancreas and causes diabetes. So red meat intake is actually a risk factor, not for cardiovascular disease, but for diabetes. But in moderation, serving or two a week is probably okay. And then the worst thing in the food supply is starch, sugar, and salt. And Michael Moss, who wrote a book called Fat, Sugar, and Salt, kind of entered that mantra into our heads. And so I still hear people say, industry is hooking us on fat, sugar, and salt. Fat is mostly good for you. Most fat is healthy fat and is good for you. So the mantra shouldn't be fat, sugar, and salt. It should be starch, sugar, and salt. Starch, sugar, and salt is what's killing Americans, and starch more than sugar. And starch, by starch, I mean Special K, cornflakes, white bread, crackers, goldfish crackers, right? All the starch that's in the food supply. And then the other highly processed foods. And I've thought a lot about what it is that makes that top list protective foods. And certainly they're all less processed, and that's important, but the middle category is also less processed. But beyond being less processed, they're rich in dietary fibers, which are prebiotics for your microbiome. They're rich in phenolics and other flavonols, these thousands and thousands, hundreds of thousands of trace nutrients in these foods. And so really what they have in common, beyond fish, which has omega-3s, and yogurt, which has active probiotics, is they're all foods that give rise to life. And so this is kind of my shorthand for what I think is good for us. And what do I mean by foods that give rise to life? Pretty much all those foods are foods that you can plant in the ground and will give rise to a new plant life. Beans, nuts, seeds, whole grains, and most vegetables are actually fruits, right, with seeds in them, like pumpkin and yellow pepper and red pepper and avocado and cucumber. Other than leaves and roots, most things are actually fruits. And so all of these foods you will plant in the ground, and you could, under the harshest of conditions, will nurture a new plant into life. The compounds in those foods that give rise to that and support that new plant life are what our bodies need with aging, I think. And so it's, again, the many compounds in these foods. So that's kind of the shorthand of what we know. What else have we learned? We've learned that obesity prevention is not about counting calories. And this goes against every policy focus that the country has had, that the world has had for 40 years. For 40 years, the country has been telling people to count your calories, exercise more, eat less, look at the calories on the back of the facts panel. Restaurants now, chain restaurants now have to post calories on the menus, right? That's only useful if calories are the right target. Calories are not the right target. It's much better to eat 300 calories of a healthy food than 200 calories of an unhealthy food for obesity. And there's lots of data on that I won't go into, but just will summarize that beyond calorie count, beyond independent of the calories of a food, different types of foods have different effects on our biology. Food is biologic information. So don't think of food as calories, think of food as biologic information that interacts with every system in your body, with your brain, with your gut microbiome, with your liver, with your fat cells, with your heart cells, with your blood vessels. And that ultimately changes your long-term risk of obesity. And there's even, short-term calories matter. Short-term, if you cut your calories, you'll lose weight. But long-term physiology will trump, your calorie counting. And there's even evidence from several trials now in humans that the type of food you eat, independent of its calories, changes the energy you burn. So your metabolic expenditure changes based on what you eat. That's actually like shocking and is now been shown in several trials. What else have we learned? Well, we've learned that the world is about more than obesity. And I think this is really important because in the 1980s, the scientific community and public health community was really focused on the cholesterol effects, the blood lipid effects of food. And that's what led to the low-fat diet. People said if you lower fat, you lower cholesterol, and we think we'll lower heart disease, right? It sort of made sense, but it was wrong. And now we're so focused on obesity that I see people talk about obesity and diet as though they're interchangeable, as though if you're overweight, your diet must be bad. If you're thin, your diet must be fine. That's not true. Obesity is just one pathway by which diet affects health. Diet affects almost every single major physiologic and metabolic pathway. And so you can't just think about a person's weight or a population's weight or your own weight. You have to think about overall food and all of the complexity. Food processing is really important. This is an emerging area of science that I don't think we yet understand enough, but we understand that even independent of nutrients and even food ingredients, there's something about processing which is bad. And this is a trial that was done in NIH where it compared two diets that were matched in the amount of fat available, sugar available, salt, carbohydrate, protein, fiber, and energy density. And the participants, when asked, they rate about the palatability of the taste of the diet, they rated them sort of equally. They didn't think one tasted better than the other. And in this randomized controlled trial, the only difference between the two diets was one was ultra processed, so highly processed foods that have basically what I call acellular nutrition, right? There's no intact structure left of the plant. So you've taken acellular ingredients and recombined them into foods versus unprocessed foods where you have the intact natural plant and animal structures left in the foods. And what they found, this is a crossover trial, so it's the same people given the same diets in different periods. They found unconsciously when people were given the ultra-processed diets, they ate about 500 calories more a day, unconsciously, without even noticing it, 500 calories more a day, the same people. And over just 2 weeks, they gained a kilogram, which is about 2.2 pounds. They gained about a pound a week without even noticing it. And on the unprocessed diet, without noticing it, they lost a pound a week, right? Kind of amazing, actually. Again, accounting for sugar, salt, other things that we think of that are addictive or problematic. So this is biology. This isn't conscious human behavior. This is the underlying biology of processing. And so at the end of the day, if we want to think about our targets and our goals, we have to move beyond this single nutrient focus, like low calorie means less weight gain, fat-free means healthy, low saturated fat means healthy. A turkey sausage link is not more healthy for you than a beef sausage link. They're both highly processed meats full of sodium. Fat-free chocolate milk is not better for you than plain whole milk, and yet this National School Lunch Program allows fat-free chocolate milk, but doesn't allow plain whole milk because of science from the 80s suggesting that fat was bad for you, right? So they allow low-fat skim milk. Baked potato chips, another one of my favorite examples, right? What are the 3 ingredients in a potato chip? Potatoes, good. Salt, and oil. The oil is really good for you. The oil is soybean oil or canola oil or avocado oil. Those are terrific oils. We should be eating much more of those. And so if you're going to eat a potato chip, for goodness sake, do not eat a baked potato chip. What you've taken out, you've reduced the oil and you're leaving more starches. Eat the fattiest potato chip you can find and dip it in oil, right? And you'll actually make it healthier for you. So fat-free salad dressing. What is fat-free salad dressing, right? How can salad dressing not have oil in it? Right? What are the I had to, when I made this slide, I had to go look. Like what all of us have had low fat or fat-free salad dressing at one point in our lives, right? What is in it? Does anybody even know what's in it? If it doesn't have oil, it's starch, sugar, and salt, and a bunch of other additives, right? So you've taken a healthy salad dressing, which has lots of healthy oils, and you've just replaced it with starch, sugar, and salt. So many examples of how kind of our policies and programs not intentionally, unintentionally are shifting us to unhealthy foods. So what do we need to do to fix this? So there's no single magic bullet. Just passing a national soda tax, or just having nutrition education in schools, or just having nutrition education for doctors, all the things that people think of, no one thing will fix the food system, but about 25 things will, 30 things will. If we do a range of major evidence-based policy and systems changes across multiple domains, we can fix all of this in 10 years. It's all totally fixable. And so this is kind of a roadmap of what we've mapped out through science and evidence, is that there's 6 domains: healthcare systems, government nutrition programs, science and research, public health and education, business innovation, and actually coordination of all of this. There's actions across these 6 domains that can really make a difference and shift the food system forward, reduce diet-related diseases, reduce health inequities, reduce healthcare spending, save money, improve small jobs, revitalize rural America. Like, this is all good. This is all win-win. So how do we actually get an ambitious program like this done? You need the federal government. You need at the top, you need to do this quickly, you need the federal government. So has this happened before? It's happened 2 times before. So first, in 1941, Franklin Delano Roosevelt convened the National Nutrition Conference on Defense to get the country ready for the war. The science was coming out about nutrient deficiency diseases, so he asked Paul McNutt, who was the director of the Federal Security Administration and was in charge of the war, getting the population ready for war, to bring together the nation's experts and decide what we needed to do to have a healthy population. It was to create a national, state, and local public work into a unified program for the promotion of better nutrition. There are really 3 major national actions that came out of this, all focused on vitamins. Number 1, vitamin-rich flour. Now 100% of white flour in the United States is vitamin-enriched. That came out of the National Nutrition Conference for Defense. The first RDAs, the recommended daily allowances, the actual numerical numbers of how much you should have, calcium or other vitamins, came out of this. And the first food-based guidelines based on the RDAs came out of this conference. So this conference was very successful in reducing nutrient deficiencies from vitamins, right? That was its goal, really sweeping national change. Now, 20 years later, the country had effectively eliminated vitamin deficiencies, but there was still caloric hunger. There was real, especially in the South and poor areas of the South, but poor areas across the country, Appalachia, elsewhere, there were areas where people literally didn't have enough food to eat and had like thin, emaciated arms and distended bellies and stunted growth. And people were very skeptical of this until they went and saw it themselves. And all of these things happened in the late 1960s. Robert F. Kennedy with other senators went to the South to the Mississippi Delta. And I have the quotes somewhere. I wish I had printed them out to read to you, but he came home, and to his family and to his wife and his staff, he said things like, I have done nothing in my career. Like if I looked at what the suffering that's there, all the work I've done has been for nothing, because it's just, he said, it's unbelievable, the suffering, and we have to do something about this. There was a photo, a very widely read series of photos by Al Clayton in Look magazine, and then most influential, this CBS documentary series, Hunger in America. And it really emphasized that there's true caloric hunger in America. At the same time, interestingly, not exactly related, but it's just interesting to see, the nation's first community health centers were opening up. And you guys should know this history, because the person that did that was Dr. Jack Geiger. He was on the Tufts School of Medicine faculty when he did this. He's well known around the country because he started the first community health centers, first in Columbia Point, Boston, and the first rural one in the Mississippi Delta and Mound Bayou. And he got some grants from the government through Tufts to open these centers, where you would go into poor communities that didn't have doctors and open these health centers. And when the federal government was auditing his program after the first year, they found that he was spending some of the money on food. And so they went down there, and the auditors went down there and said, you can't spend money for food. You're spending your pharmacy budget on food. That's against the rules. Food is not a drug. And this was his answer. He said, well, the last time I looked in my medical textbooks, they said the specific therapy for malnutrition was food. So he said, I'm going to keep doing it. And they said, okay. And they went back and they stopped bothering him. So he kind of had this idea at the same time in the 1960s. And so what that led to was in 1969, Dr. Jean Mayer, I hope you guys have heard of Jean Mayer. Dr. Jean Mayer went to President Nixon and convinced Nixon that we need to hold a White House conference to address this. He was able to also secure the support of George McGovern, a Democrat, and Bob Dole, a Republican, and host a national strategy. And this, like was even more influential than the 1941 conference, because this was a White House conference bringing together all the agencies. And these were the major outputs of that program. Major expansion of the food stamps program in just 3 years, from 2 million Americans to 11 million. Major expansion of the school lunch program from 2 million to 8 million in just 3 years. Creation of WIC, the program that feeds pregnant mothers and babies up to age 5. 1 in 2 babies born in the United States are on WIC. Creation of the school breakfast program, creation of the nutrition facts panel, and creation of the modern dietary guidelines process. So this transformed the country's policies around calories and getting calories to people. So the 1941 conference was huge for vitamins. This conference was huge for calories. And caloric hunger was largely eliminated. Now, there are still families going to bed hungry without enough food on any given night, but over the course of a month, over the course of the year, there's, other than people who are really potentially homeless or not getting any food, there are very few Americans who actually don't have food anymore, right? They have bad food that's making them sick, but this essentially eliminated true caloric hunger. So that brings us to 2022. It's been 53 years since the 1969 conference. In addition to food insecurity, there's still food insecurity where families can't get reliable access to healthy food, and it's very problematic. There's now this incredible rise of diet-related diseases. And so on September 28th, President Biden opened the second White House conference on hunger, nutrition, and health. The pillars and the goals were improve food access and affordability, integrate nutrition and health, empower all consumers to make and have access to healthy choices, support physical activity for all, and enhance research. And it was attended by the Secretary of Health and Human Services, the Secretary of USDA, the head of the Domestic Policy Council, several senators and congressmen who supported it, including Congressman Jim McGovern from Massachusetts, who's been a great champion for this, but also Senators Booker and Braun and others. And you should know that, like the 1969 conference, Tufts had a big role in this conference, and so you should be proud of that. In 1969, Jean Mayer was actually tasked by the president in organizing the conference, so that was terrific. The White House organized it themselves, so Tufts didn't have any formal appointed role, but we played a huge role in the background, first getting the conference to happen and getting the White House to yes, and making sure there was bipartisan congressional support, in influencing and ensuring that it had equal focus on hunger, nutrition, and health. And then finally, we convened a series of national gatherings and listening sessions around the country to create a multi-sector report on recommendations to the White House for what the conference should focus on. And you should go to our website, informingwhc.org, to read the report. We had a terrific task force that was co-chaired by Chef Jose Andres, by former USDA Secretary Dan Glickman, by former Senate Republican Majority Leader Bill Frist, who's a cardiovascular surgeon, and by Earthren Cousin, who was our commencement speaker last year, who's the former director of the World Food Program. And that task force and the national convenings we did and the listening sessions we did came up with this really terrific report. And the White House at the conference released their national strategy. And about 95% of what was in our report was in their national strategy. Obviously, it wasn't just us. The other groups recommended lots of things too, but I can say, that we definitely had a positive influence on the strategy. So I just want to, highlight high-level things in the national strategy for you to see the scope and breadth of the national strategy. It's a whole of government approach to do this. And the goals are to end hunger, significantly improve nutrition, and significantly reduce diet-related chronic diseases by 2030. And so under the pillar of improved food access and affordability, the goals are universal healthy school meals, summer EBT, which is summer meals for all kids, to increase fruit and vegetable incentives in SNAP, the food stamps program, to increase the retailer standards for healthy foods in SNAP, to increase nutrition standards for school meals in WIC, streamline enrollment in the federal nutrition programs, increase tribal food sovereignty and access to traditional foods, and increased breastfeeding support and counseling. All of these have very, very specific statements on which agencies are going to act to do them or what Congress needs to do. So lots of really great commitments there from the White House. Under integrating in nutrition and health, there's a lot on food as medicine. And food as medicine is about having the healthcare system, which is such a big part of our economy, actually support healthy nutrition and pay for healthy nutrition for patients. And so this includes things like medically tailored meals and produce prescriptions and RDN counseling in Medicare and Medicaid, produce prescriptions in the Indian Health Service and Veterans Affairs, increased access to programs like the Diabetes Prevention Program, universal screening for food security and social determinants of health throughout the federal government and private healthcare, creating a stronger and more diverse RDN workforce, training for medical providers, and other things. There's a lot under empowering consumer choice and access. I'm not going to go into all the details. I really encourage everybody to read the White House National Strategy, but a lot about leveraging the power of the Small Business Administration, Housing and Urban Development, the Department of Transportation, the Department of Commerce, FDA, USDA, to kind of create more access to healthy food around the country. There's really great things on physical activity, increasing use of an access to parks and other things and CDC programs. And then there's a lot on science, and science is really key as well. So the White House also called for a whole of society approach. They said government can't do this alone. And so they called on the private sector, on states, on nonprofits to do a lot of things, including calling on health professional schools to teach nutrition to physicians and others, for health insurance companies to pay for patients to access healthy food, and so on. And these are some of the examples of the new commitments that were made by the private sector last week, or 2 weeks ago now. Kaiser Permanente, the largest HMO in the country, committed $50 million to expand their food as medicine program. The Rockefeller Foundation and the American Heart Association committed $250 million to advance food as medicine research. The American Academy of Pediatrics committed to offering training to all their pediatricians on screening for nutrition security and referrals, and so on. So a lot of great private sector and nonprofit commitments. So I'm just going to end with just highlighting what I'm really excited about in the national strategy, what I want to see happen. I think food as medicine is huge. I've talked about how much our healthcare system has exploded in cost and complexity. And if we can use some of those dollars to pay for healthier food, we're going to transform access, demand, supply chains, everything, because money and demand is going to come in from healthcare dollars. And we've just published this paper with the CDC on kind of a food as medicine pyramid, with the sickest patients at the top getting the most intensive treatments like medically tailored meals, down to population level healthy foods and programs. So I think this is really exciting. Nutrition education is really exciting, and the US House passed in May of this year a resolution basically saying that we want medical schools and other training programs to train physicians in nutrition, and if you don't, we might take away your money. So this is a really, really important resolution passed by the US House. I really encourage people actually to read this. It's just a terrific 5-page document as well. Nutrition security in the nutrition programs is really important. From 1969, the US has these amazing food security programs like school lunch and WIC and SNAP and Meals for the Elderly. They've mostly focused on food security with the exception of WIC and school meals, not nutrition security. And USDA has really shifted under the leadership of Secretary Vilsack and Dr. Sarah Bleich, the new director of nutrition security, who's from Harvard School of Public Health originally. They really focused on nutrition security. So this is a terrific advance in the nutrition programs. We need to leverage public health and education. I told you how little funding goes to FDA and CDC compared to healthcare dollars. There's a lot in the national plan around expanding dietary guidelines and FDA and CDC. There's a lot in there around expanding nutrition science. And so this is really important. If you guys have questions, a lot of questions you raise might be about, well, should I eat this? Or is this really good for you? Or the answer to most of those questions will probably be, I don't know, because there's so much we don't know in nutrition science. And we really need to invest in this and understand what's going on. And then we need to catalyze business innovation. This is sort of the last thing that I'm really excited about. The private sector has a very positive role to play, from farms all the way to wellness and supplement and restaurants and retailers, if it's science-based and if they're rewarded for doing the right thing. And so there's a lot of strategies the government can do to reward the private sector. And if this sounds strange to you, just think about green energy and think about all the investments the government has made and the new Build Back Better bill. I think there's $280 billion of investments for green energy in that bill. We can do the same thing in food. We can invest hundreds of billions of dollars to modernize our food sector. And I mentioned the Food and Nutrition Innovation Institute at Tufts, at the Friedman School. This is a university-wide resource all of you should use. These are the companies, nonprofits that are all part of the Nutrition Innovation Institute that you guys can access and talk to and learn about what they're doing in this space. So what's our next steps? You know, Tufts has been working since 2014 to get the second White House conference to happen. So we've been working for 8 years, and it really is, without hyperbole, a once-in-a-lifetime event, right? This event that just happened is not going to probably happen again in any of our lifetimes. And so we have to make sure that it wasn't just a photo op where everybody hung out and took pictures and was happy, but there's actually real action. Given what happened after 1941 and what happened after 1969, I'm optimistic we're going to see real change now. The president has made a commitment. There's champions in Congress. And so what Tufts is going to work on is continued outreach and advocacy to the agencies in the White House, to bipartisan leadership in Congress. We're going to continue to convene the private sector and nonprofits, focusing on the food sector and the healthcare sector for their commitments. We're going to work with states and cities like New York City, for example. We're going to try to communicate and disseminate to the public, because the public doesn't even know any of this is happening. And we're going to try to really make sure there's commitment, action, and accountability. So I wanted to give you that overview and happy to answer any questions.
Any questions?
Do you think that these policies will also be implemented in school food lunch programs? And like, would that improve the school lunches?
Yeah. So, you know, one thing that I skipped for time, but I'll go back to, which I think is really important, is we published a paper looking at the quality of food across the country, and what you know, sources of food are good quality and what sources of food are bad quality. Oh shoot, did I pass it? Thought it was in here. It is in here. Just give me a second. Sorry. Oh no, it's not. Oh yes, it is. There it is. Okay. So this is an important point. So what this chart shows is from 2003 to 2018, about a 15-year period, what proportion of foods and beverages overall are of poor nutritional quality as consumed by Americans. Not what's on the menu, not what you can buy, but what people are actually buying and eating. So higher is worse. Higher means poor nutritional quality. So at the worst is restaurants. And restaurants really get a free pass. Lots of people talk about, you know, Coca-Cola being bad for you and you know, all these products in the grocery store. But 20% of our calories from restaurants. Restaurants are really terrible. And this includes sit-down restaurants as well as, you know, fast food restaurants. So 80% of food in restaurants is of poor nutritional quality. Other sources like food trucks and entertainment venues has actually gotten worse. It's gone from about 40% being poor nutritional quality to over 50%. Grocery stores has gotten a little bit better. Americans are choosing and there's healthier options. So it's gone from about 55% poor nutritional quality down to about 45% poor nutritional quality. But if you put it all together, restaurants 80% bad, other sources, grocery stores about 50% bad, and not a huge improvement. And so if you look at all the things we've done over the last 20 years, dietary guidelines and public health officials and us publishing and stories in the media to try to improve diets, this is what's happened, right? Restaurants, other sources, grocery, that's pretty much what's happened. Like hardly any movement, a little bit of movement. Now look at schools, look at the nutritional quality of school meals. Before 2010, about 55 to 60% of school meals were poor nutritional quality. So that was the reputation school meals had, right? It's a terrible place to eat. And after 2010, there was this rapid improvement to now, today, schools are the single healthiest place on average that kids and adults can eat in the United States. So now it's only about 24% of poor nutritional quality, which is still bad, 1 in 4. So what happened in 2010? Like why is everything else not moving and there's this huge improvement in schools? So Michelle Obama, what specifically? Yeah, she helped get passed. Yeah, it wasn't Let's Move. Let's Move didn't do it. Let's Move was kind of a national program, right? It was a specific law that she did really promote and helped pass. It was called the Healthy Hunger Free Kids Act, and it greatly and dramatically improved the nutritional standards of school meals. More whole grains, more fruits, more vegetables, less sodium, eliminated sugar-sweetened beverages. It had all these great things. And so a single policy, a single law in just a few years dramatically improved nutrition for tens of millions of Americans. And when we looked by race, ethnicity, income, or education, there were huge disparities in all of these things. And so for white Americans or higher income Americans, the restaurant meals tended to be better versus others and so on. This improvement was exactly the same by race, by income, by education. So to me, this shows the power of policy. So it's not exactly an answer to your question, I'll get to your question, but it shows the power of policy and systems change, right? What you can do versus education and knowledge and telling people to eat better. So that being said, schools are already much, much better than they used to be. And so in the national strategy, and part of our advocacy efforts will be two things. One is to be sure that more lower income kids have free school meals. And so there's something called the CEP, which gives entire communities eligibility for free school lunch. So you don't have to go, right? Previously, you had to go student by student, and students had to apply, and it was caused bias and prejudice, and they might have to give a different card in line. And now the CEP lets a whole school apply based on their average income, and then everybody in the school gets universal school lunch. And so we want to expand the CEP. And then secondly, we want to strengthen school nutrition standards. This is still too high, and we want to make it better. So I think schools are important. On the flip side, schools are only 9% of calories for kids in the United States because it's 180 days, that's the whole year, because it's 180 days, and so it's already half the days. And as much as we think school meals provide a lot of calories, they don't provide that many calories. So this is 9% of calories. Grocery stores are about 70%, and restaurants are about 20%, and the rest is other sources. So schools are important, but it's only 9% of calories. So it's not going to move us that much. So it's definitely, like I said, it's one of the suite of 50 solutions, but it's not by itself going to move the needle.
Thanks. I've actually got a question, and thanks for a great talk, all the work you did. And I thought the food as preventative medicine idea is really, really fantastic. I thought of this talking about the 2010 law, the elimination of sugared beverages and so forth. And when I was reading your description, I kept hearing increase in funding, incentive. And I kept thinking, rightly or wrongly, carrot, 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 carrot. And so I just wanted to ask in a totally open-ended way, what do you see as some major sticks that might be necessary?
Yeah, so I think that, carrots are always more politically feasible, but they cost money. And so the only way first we're going to even get the money for the carrots is to lower healthcare spending. So that's the virtuous cycle where if we can lower healthcare spending, we can have more carrots. I think the sticks that are important, I mean, one thing that's very controversial is SNAP. And so SNAP is about $100 billion a year, much, much more during COVID, but post-COVID, it'll be about $100 billion per year. The major nutrition program for low-income Americans, it doesn't have any real nutrition standards. And so there's a lot of discussion and controversy about sticks in SNAP. Carrots, everyone agrees with. Let's give people more money to buy healthy foods, but it's already a $100 billion program. How are you going to get people to agree to pay for more? And so having sort of pilots that test different approaches, maybe disincentives, behavioral nudges, restrictions some people support, very controversial, like restricting sugar-sweetened beverages. I think pilots to test what people actually like and what works is a potential stick in SNAP, although as I said, it's controversial. I think for the private sector, I think that it's very hard for the FDA to mandate things because of sort of statutes. They were able to get rid of industrial trans fat because the evidence was enough that it was universally harmful at any dose. And so they were able to get rid of industrial trans fat. For FDA to get rid of processing or salt or sugar, I don't think they can do by mandatory means because you can't say any sugar is bad for you or any salt is bad for you, but they can do more than they're doing through voluntary standards on sodium and sugar and other things, which they've been very slow to implement. I think we could easily pass a national soda tax from a legal perspective and an administrative perspective. We have many excise taxes, federal excise taxes. We have federal excise taxes on tobacco, on alcohol. I think we have federal excise taxes on cars, on skis, on a bunch of stuff. We could pass a national soda tax, but I don't think politically it would happen. But states could do it. Massachusetts could pass a soda tax. And the nice thing about a soda tax is it generates revenue that then you can then use for the carrots for low-income Americans in particular. So I think a soda tax could be, should be done and could be done, but I don't know if it's politically feasible at the national level. I think it's feasible at the state level. I think for tax policies, the one thing that's been mentioned is eliminating the tax, when businesses spend money on an expense, they can then say it's tax deductible, right? If they spend money on marketing, they don't pay taxes. There has been discussion that if companies are marketing unhealthy foods, they should not be able to take a tax deduction on that. That has been thought about and proposed. I think that's kind of challenging to implement. How do you define what's healthy and unhealthy? Can you get Congress to pass that? How can you decide if the ad is really about that product or other products? But that's something else that's been mentioned. But by and large, I think in the United States, given the First Amendment and free speech, and given sort of the political climate, I think carrots are more politically feasible than most sticks. And to pay for them, we have to show healthcare savings, I think.
Hi, I was wondering if you could speak more on plant-based proteins, specifically if they were discussed at the White House National Conference and also the nutritional quality of them. I know that there are a lot of ultra-processed plant-based proteins that are out there and how those can compare.
Absolutely, yeah. And I should just go back to Colin's questions. I thought of one of them. This isn't really a stick, but it's sort of a stick put through elimination. Is we're working at the school a lot on ESG investing and having both large institutional investors and venture capitalists invest in companies that meet certain environmental, social, and governance statutes. And nutrition isn't really part of current ESG metrics. And so if we can develop ESG metrics, it's still a carrot. Companies will get invested in if they do the right thing. But then by definition, if there's a limited pot of money, they're not going to get invested in if they don't do that. So that's mostly a carrot, but partially a stick. And so I think investor money is really important. So protein. So the first major point is that none of us need more protein. So there is no protein deficiency in the United States, and there's no evidence that eating more protein is good for us. And so somehow it's become part of the conventional wisdom that you got to eat your protein. I got to have my protein in the morning, or it's going to be more satiating, or I'm not going to gain weight. We don't need more protein. And the only real proven benefit of protein is if you're exercising and working out to build muscle, you build more muscle. For sure. Whether you're actually stronger or fitter is unclear, but your muscles are bigger for sure. And so people who are trying to work out and build muscle, yes, if you eat more protein, you will build more muscle if you're doing isotonic strength training exercises at any age. But since most of us aren't doing that regularly, there is really no health benefit to protein. And it's sort of like carbohydrate. If you remember back to your high school biology, if you eat, or college biology, if you eat carbohydrate, some of it gets taken up into the muscles. That's needed right then, not very much. The rest gets refills your glycogen stores, and then the rest gets turned into fat. Actually, the rest goes to fat cells. So the starch gets turned into fat. The same exact thing happens with protein. When you eat protein, a little bit gets taken up at your muscles. If you were recently building your muscle, what happens to all the rest of the protein? It gets turned into fat. right? And so lots of studies have shown that people who eat more protein have higher risk of weight gain and higher risk of diabetes. So there's a really bizarre, idea that we need more protein. And the plant-based protein companies have pushed this by saying we have a healthier protein, right? So I think that's a big misunderstanding. Now, there's a sustainability benefit to plant-based proteins versus industrial livestock, for sure, absolutely 100%. Is there any health difference? The amino acids are essentially the same, right? Protein is amino acids, very simple molecules, essentially the same. And so there's really no evidence that a plant amino acid is really different from a animal amino acid. It's the same thing. So I don't think there's any evidence that a plant-based protein, quote, is healthier for you than that. And then the last question you asked about the processing, if you're eating a processed food, it's probably bad for you. And so is eating a portobello mushroom as a plant-based alternative good for you? Yes, because it's a minimally processed food. Is eating an Impossible Burger or Beyond Meat burger or a oat milk better for your health than the animal alternatives? Probably not. Is it better for the environment? Yes. And so I think it's the plant-based protein movement. Its science is around sustainability, and that's where they can hang their hat. But their marketing is also around health, and I think that's misleading for the two reasons. One, it's the same protein, it's the same amino acids, and two, we don't really actually need protein. What we need is fat, and so we should really be eating more healthy fats. That's really and more minimally processed foods. Yeah.
We have a lot of questions online. I know we are right at one, so can I ask you one last question for the people online?
Yeah.
Although I was very interested in the environmental line, this is a little bit different. So let's finish with this one. Kathy Stanton asks, in regards to the planning of this particular conference, could you say something about discussions in the planning process about equity and disparity, especially along racialized lines? Who was pushing those conversations, and do you feel as though they informed the program deeply?
Yeah, so I think this was something that the White House did really, really well. And I want to give them kind of an A+ for, is centering the whole conference on equity and disparities, and it's particularly racial equity and structural racism and the history of structural racism. They made that a priority from the beginning. They included in their planning discussions the voices of people from traditionally marginalized backgrounds and included them in their planning discussions. They included them in the conference and folks spoke in the conference. We similarly had that same commitment. And as I mentioned, we had 16 listening sessions around the country with people mostly from lower income neighborhoods, mostly from racial and ethnic minorities around some of these issues. And there's a lot in the national strategy around that, particularly around tribal sovereignty, but also other programs that will address it. So I think they've done a great job with that. And I think that's one of the things that the Biden administration, so President Biden and thereby his whole White House, this wasn't on the top of his list when he took office, right? Nutrition was not on the top of his list, but racial equity and hunger were on the top of his list. He did talk about that when he came in. So I think he really does believe in racial equity and nutrition. And USDA under Secretary Vilsack has done an enormous amount to address sort of structural inequities at USDA. So I think that's been terrific. And now I hope that nutrition and equity in nutrition will also enter, I hope, the president's priorities from this conference.
Thank you so much. Let's thank Dean Mozaffarian one more time.